Welcome. My name is Scott Wrighton. I'm a consultant and I work with SEMA. Today what we're going to do, a few things we're going to make sure is we're describe the fundamental components of a COOP. Okay? So what are those components of a COOP? Describe the basic process involved in developing a COOP. Identify guidance and standards to develop a COOP. We're also going to describe the CMS required elements of COOP. All right? And then we're also going to describe how a COOP is activated and used. So module 1, we're going to talk about the key concepts of a COOP. All right, so continuity operations plan. So what is COOP? It means an effort with an individual executive department and agencies to ensure that primary mission essential functions continue to be performed during a wide range of emergencies, including localized acts of nature, accidents, technology, or attacks related emergencies. That's the technical term, but there's many definitions to it. There's actually a simpler one that I like better. But the effort to assure the capability exists to continue your essential functions across a wide range of potential emergencies. Basically what it is, the process of maintaining your operations. All right, so that is simply COOP. How do we make sure we're providing our services for our clients / patients out there? How do we continue our services? When can we continue them? Where can we continue them? All that stuff, all right? Just want to make sure we have that definition of COOP in place. Purpose, again, to establish critical operations in the event of disaster or emergency which causes normal operations to alter. Okay, so that's why you're doing it, because it's when something happens. It doesn't have to be a disaster, or an emergency. It could be just your facility that has an issue, right? To ensure the capability to support employees, contractors, if you're using that, emergency responders that may be involved, the clients, and the general public during these events, okay? In our COOP plan, we're gonna make sure that happens, right? That's why we test them, okay? We test the plan. Even though we write the plan, it's not always perfect. All right, so key components to a COOP. So the COOP plan, you wanna make sure we gotta answer some questions. What critical things do we need to do? So what? What critical things do we need to do? Then we gotta say who will do them. So our COOP is gonna have that. So what are those things? Who is going to do them? How will they be done? What equipment and resources are there? Where will we be doing these things? Because it could be alternate site, right? Somewhere else. Okay, so where? When? How quickly can we do them? All right? How quickly can we get going again? Can we get operational again within, 12 hours? Can we do that? Make sure we're operational. Then we also have a couple other things. Who's in charge? That's always a good question, isn't it? And what if they can't be in charge? Okay, who's the next person up, right? So our deep people. All right, so how will we return to normal? And what if we can't return to normal? Those are the big questions we have to fill in our COOP. So what do we need? We need executive buy-in and support. If you don't have this from the beginning, you're not going to go anywhere. You need them because you're probably going to need some funding, because you're going to be pulling people away, staff away from their normal position, and they're not going to want to pay them to go to meetings and stuff like that, okay? So you got to have that executive buy-in and support. COOP planning program. We want a program. It's not just a plan. We have to look at these annually, so it's actually a program. You're creating a program so it's constantly moving. It's a live document. So what you want to have is a COOP team. There's two different teams you're going to have. You're going to have a COOP planning team. And that planning team can be a committee. They can minimally meet annually after you finish your first plan. You can just do an annual team can meet to review the plan. Okay? I'd prefer probably 6 months at least. Maybe even quarterly. You can take sections of the plan and look through them and review them. Okay? But keeping that consistent COOP team. So most facilities you can probably get away with, about 4. 4 people on a team is kind of a good way to go. You have a larger facility, throw some more people in, okay? Maybe some more departments want to have a little more say in it. Organizational awareness and participation. So not only just the team knows about it, but we want to make sure our whole organization, all of our staff, they need to know what COOP is. They need to know what's going on with it. All the department heads need to make sure what's going on with the COOP plan. Project planning tools, okay? You have some tools that'll help you do the COOP planning process, also help you with the reviews, updates and everything. So you're gonna have some milestones you're gonna create. Simple sheet. It could be a one-pager. Have milestones. You're gonna have timelines to that and when you want those completed by and any resources that you need. So, process. Clearly defined plan development process. So very simple there. Typically, if you get a team together, most agencies can do a pretty decent COOP plan, 6 to 9 months. It can be shorter than that, but in an organization like most of yours here today, 6 to 9 months is doable. Sometimes about a year can take, okay, to do a decent plan. Okay, initial planning process. We're going to identify our planning team. So we got to go find people to be on this COOP team, this planning team. What you want to do with this team, though, is you got to make sure you got to identify the roles and responsibilities for those team members. What is their role within that team? Okay, there's, like you said, you can have team leaders. They can separate into the departments, however you want to identify your team. You can have all your planning team be department heads. I wouldn't. I'd probably have somebody from each department. Review your current plan. So if you have a current plan, review it, right? But you're also reviewing other plans. Now there's some other plans you may or may not have, okay? But there's hazard mitigation that the county and the city may have for you. So those counties have hazard mitigation plans. In those, they have like risk assessments and those types of things in your hazard mitigation plan that can maybe help with your process with your COOP, okay? We also have emergency operations plans. Do you have an emergency operations plan in your hospital? Review those, right? Because we're not going to create a COOP plan that is not talking with the EOP, all right? And a lot of times, your COOP plan could be an annex to your EOP, all right? It doesn't have to be a totally separate document. It can be within your EOP. Facilities, emergency plans. So the emergency plans of your facility, look at those. Look at the, what's the fire routes and exits like that, tornadoes, those types of things, tornado shelter. You're looking at all these plans while you're doing before you do your COOP. Pandemic or, that bad day thing there, those types of plans you have in place. Look at all these things because they all need to be reviewed to how you build your COOP plan. Develop project plan again. So you're gonna develop that project plan. What's our timelines, things like that. Budget. Yes, budget. That's the fun part. We gotta have a budget for this, right? Because you're gonna have to say, how much time is this gonna take me? How many people are here? What's the budget? Because that's what administration is gonna wanna know. What is the financial impact of this? Again, leadership support, I throw it in there again because it's important. Got to have support from leadership. If you don't, it'll fall away. It'll die on you. Because you got to remember, you might go somewhere next too. If you're the leader of this group and you go to a different job, you go somewhere else, it may drop. So if you have that leadership going, have a team established, it doesn't matter who's there, the program should stay. Okay, so it's about a process. So here's a quick little thing on steps to program development. Designate the COOP planning team, identify operating unit roles, right? We said that, right? Assign responsibilities to that team. Develop basics for planning in the program. We're going to develop planning assumptions. Assumptions are what ifs, right? What's going to happen if this happens, those types of assumptions that are going to take place. We're also going to go with determining COOP activation team. Different team, right? Not your planning team, your activation team. So when COOP needs to be activated and used, who is that? Who's making the call? Who's the one saying we need to activate our COOP plan? And who's the team that's going to carry that out? It's not always the department heads, all right, that are going to do that. It's going to be a designated team that's going to go into action, okay? And that team's going to be multiple people deep, okay? Again, at least 3 deep, I would have that. Develop a COOP. You're going to develop the COOP plan, all right? Pretty easy there. So we're going to develop incident-specific procedures for priority, hazards, and threats and events while we're developing that COOP. And we're going to coordinate with external entities, vendors, stakeholders, partners. Look at all the stuff there, what they have, what the risks are. Your risk of your vendors coming in your facility, what are they carrying? Is there hazardous materials, things like that? You gotta look at all these things. And then what you have to do is if you move, right, you're gonna go to an alternate site, you gotta get a hold of these people and coordinate how you're gonna communicate with them to where your new site is and what you need. So to make sure these vendors are you have great communications with them, all that good stuff. We'll go over that in a little bit. Provide education and training to staff on the COOP and implementation. Implement the COOP. Conduct ongoing reviews and corrective actions for COOP each year. Okay, that's the goal. You want to get those 10 steps. They don't have to be in the exact order, but there's basically some 10 steps to kind of simplify a little bit. That's part of your kind of your project plan schedule in a way. All right, so another portion of the initial planning meeting is what we want to start out with. So you get your team, you want to get those people together. So your first meeting, we call it the kickoff meeting. So we're going to do a COOP overview with them. So just a simple overview. It'll help process with it, get them on the same page. So you'll talk about the purpose of that group. What is the purpose of this group? What are we going to be doing? Those other steps we just talked about, that's what we're doing. Identify the team roles again. Who's doing what? Who's the team leader? Who's talking to administration? Who is going to each department to get information from? Because we're going to be collecting data and information from people. We're going to develop a work plan in this meeting. So we'll make sure we have that work plan, that schedule. Year and a half out, 2 years, whatever it is, we're going to schedule that work plan out. Okay, we're going to try to meet those. There's some deadlines you want to hit in those, milestones. You're going to set up future meetings and times if you can right there. However many that may be. It can be anywhere from 6 to 20. Depends on your needs. With a smaller group, it's easier to have maybe just a few meetings. Larger groups, sometimes you have a little bit more meetings. All right, discussion of the items. And those items that you want to discuss right away, the kickoff portion, this is opinion. This is not set in stone. This is how you ever want to do it. But you're going to want to discuss essential services. You want to discuss alternate locations and orders of succession. Those are some 3 key ones we can look at right away. We're just going to discuss it. We're not going to spend 2 days on it, okay? We're going to discuss it, and we're going to say, go get more information from your departments. And so I'm not going to go to a department and hammer on 18 things. I'm going to come to them and say, let's talk about these 3 things, okay? What's the essential service you're providing in your department? Okay, what's the most important things? Let's rank these things. If this would happen, give them a certain scenario, okay? If this happened, what do we need to provide? What can we not go without, all right? If we had to go to an alternate location, what do you need for that alternate location? What are the needs here? Each department has different needs, okay? You can talk about orders of succession. And we'll have definitions of these a little bit later on. But just a little process with your first meeting to get them started. Then you have your next planning meeting. You can come back. Planning team information gathering meeting, okay? So you're going to review department information that you went and sought, and try to get. So again, we're going to go through this stuff. So we're going to review these 3 areas in our next meeting, okay? So we're not doing the whole COOP plan. We're just reviewing a few of the things. Then we go ahead, and before we leave, we're going to introduce some new things, okay? Again, no particular order. Pick what you want. Devolution, vital records, and interop communications. Come back again. We're going to review those other things, and then you can go through that process throughout and give different categories each time you meet. Then you get to a point where you're able to reviewing all the information you have. You can start drafting the process anytime. You can start a drafting process going. You have a template you can find. So I'll show you a few things that are more shells that you need to add your information, okay? You don't want everything just to be spelled out for you because it won't work for you. You may think it does, and you're saying, "Oh, stamp my card, got my COOP plan done." Nope. It may not fit you. So you actually have to read them and go through them and change them. So when we draft produced, feedback process from the draft, if you do that. So if you're starting the draft process, when you have a timeline, okay, how you're going to get feedback from that draft once you put it out, okay? So you're going to talk about these things. This is the goal one of the final meetings for the initial initial planning team. So I skipped ahead because I don't know how many meetings you're going to have, all right? You have multiple meetings in there. Review the draft feedback that you got from everything. This might take a few meetings to do this. Make any changes to that draft that are necessary to be made. Hopefully you've been making them as you've gotten them in anyway, so the team can just kind of review the changes that you made. Then you finalize the presentation to leadership. That's what you want to do. You want to have it then present this to your leadership group. Again, for buy-in and support. So you got the buy-in support to start the project. Now you're putting the finishing touches on it. We got to show them so they have big support. So now you can enact it. Okay, now it's operational. Talk quickly just on exercises real quick. Conduct annual tabletop exercise to review COOP. You can conduct any kind of exercise if you want to. It doesn't mean you have to do the entire COOP plan. You do portions of the COOP plan. You're testing certain areas. So process those changes. When you do review your COOP, make any changes that you need to be make. If you have staff changes, you need to change some things. Typically, because you will have contact lists in there that some will have changes. A lot of times we like to put positions in there too, so we don't have to make so many changes, not the name. But sometimes you may have a change in maybe an email or a phone number may change for somebody. So that is possible. But staff changes, try to leave the names out as much as you can. Try to do positions, but sometimes, like most of you probably have 18 positions. So which one do you choose, right? So sometimes you may have to put the name in there and that's okay. All right, just know you have to change it in your COOP plan if that person was to leave. Essential services changes. Maybe you started doing something now. You're offering a new service. It needs to be added in. Maybe you dropped a service. Take it out, okay? We don't normally do that when it happens, right? Start a new service, we don't think of the COOP. That's why we review it, okay? Facility changes, remodeled, new, all those things. Any type of facility changes, we need to address that, okay? Because it may help with your COOP operations. New facility could very much help you because maybe now has a better backup system, electrical system for your agency, which will help with your COOP process. We'll get to that a little bit later too. All right, plan elements. Essential functions. So we'll review all these. I'm just going to put them up on the board one at a time. We'll review them all as we go here. Alternate facilities, vital records, orders of succession, delegation of authority, human capital management, testing and training, communications, the list goes on, yes it does, devolution, recovery, okay? These are some of the key elements to a COOP plan. Essential functions. Identify the services and functions that must be continued, okay? We need to carry this out. Very important, each department has to figure that out, what those are. They should know, but there's also a thing where a department thinks everything they do is essential. So that's why we have to have a planning team. That's why we have to have leadership sometimes to make that decision, right? So especially if you have somebody really strong in the planning team that wants everything in their department to be essential, yeah, well, it doesn't work that way. Prioritizing the time frame for being operational. This is where it's important. This is why it's important for each department to identify their services because it's going to show how quickly you can get going. So this is an example on the time, okay? So you don't have to have these exact times on the priority. What I showing an example here is there's 4 sets of priorities I have here. You can have 5, you can have 6, you can have 7. Don't care. You can have certain time frames are different if you want to, okay? But this example, priority 1, within 12 hours, our main essential functions, those are priority 1 functions. So we're gonna have here's a service provided on our COOP plan, and it's a priority 1. That means within 12 hours, we gotta make sure we're having that being done. Maybe it's continued and you didn't have to wait the 12 hours, that's great. But within 12 hours, all the priority 1s need to be operational. Okay, does that make sense? Excellent. Priority 2, within 72 hours. You might make it 24 hours. You might make it 36 hours. However you want to make your priorities, that's important. Priority 3, within 7 days, so 1 week, okay, 1 full week. Maybe it's 10 days, maybe put 15 days, it's okay. 4, as possible. Basically, whenever we can get it going, we don't have any deadline on it. You can also put in here 30 days, because the COOP plan, what is that for? Actually, to be operational for the next 30 days. Because we hope to be back to normal operations after 30 days, we hope. That's the goal. But the COOP plan is supposed to be operational for 30 days. That's what it really is about, being operational for 30 days. So it could be the priority 4 is the 30-day thing, and priority 5 might say, we're just not going to do that. We have an emergency going on, we've activated our COOP plan. Priority 5 is, we are not worrying about that at all. It's a service we are stopping. okay? Maybe because we can't, okay? Maybe you had a fire in your surgical wing. You can't do surgeries. 30 days is gonna be fixed. Maybe not, right? Has to get inspected, all that good stuff, right? So you may have to be out. So again, it's very fluid. You can change what you think is necessary for your facility, okay? So that's the most important element though, trying to find those priorities, because that drives your essential functions, okay? We also have essential positions, right? Our necessary provision of the identify the essential services. So we gotta make sure the positions are actually essential too. So lines of succession for leadership, it's an important piece. The boss is in Hawaii, crap hits the fan, who's in charge, right? So we wanna make sure we have those succession in place. We like to go minimal 3 deep with all of our stuff. But positions are important. Those positions are very important because we wanna make sure who is actually gonna take care of things, who's in charge with those essential services. Identify primary person, and again, 2 alternates for each area is so important to do that. Have they been trained on emergency role? Because that's important. Have they been trained on how to lead? Have they been trained on what incident command structure, right, that you have? So make sure that they are getting those trainings. That's why it's important we identify these people / position people so they can get their proper training ahead of time. Because when you need them, we gotta make sure they're trained, right? And do you have job action sheets for this? So job action sheet is a list of what needs to be done for those positions. Now in the emergency management world, emergency operations center, you have emergency operations centers for your hospitals. You can have job action sheets for the positions. So that's what you want to make sure we have with this process. It doesn't have to be in your COOP, okay? But we throw it up there to make sure that you have that up there, just to kind of help them out with their job. Because these alternates may not be totally familiar with everything. If they just have a little cheat sheet they can go by a checklist, it's great for them. Orders of succession. Identified orders of succession are an essential part of the continuity program, okay? They ensure that personnel know who assumes authority, okay? Who's responsible. Department leadership, and that leadership is incapacitated or becomes otherwise unavailable during continuity situations. So if that leadership is down, who steps up next? And sometimes you have a domino effect. Head person goes down, next department head comes up, now you have the next person stepping in. So you could have multiple people changing positions. So that's why you don't always have the next 2 people being the next over here. Because all of a sudden you're using all your people and it's like, well, we didn't really have 2 deep. So you have to watch that, okay? I understand that that head person may be the next 2 people in line that already have jobs doing a COOP operation. So that's okay. But after that, you're gonna make sure you have your 2 deep as much as possible in those positions. Delegation of authority. Very important piece. So, provides dispersed personnel with the authority to make key decisions during continuity situation where the primary decision maker is not available. They're not there, they're on vacation or whatever. You called them, but the phone was going crazy, so you just had, let's see, who's in charge? We have delegation of authority. We can do these things. They're predetermined, and will take effect in an emergency situation disrupts normal channels. You probably already have that in your hospitals, right, already, with maybe some nurses, maybe some RNs have some authority to do. If a doctor cannot be reached, what can they do? What are their processes that they need to do? So normal channel direction control ends when the department is able to reestablish those channels. So you can't just let people just sink out there and say, well, nobody's in charge. We're just gonna stand around and do nothing, right? So you gotta have that authority where typically you get in trouble if you did that. This kind of steps you and says, hey, you can do it. Okay, so have those things spelled out. Alert notification implementation. How do you notify staff of COOP activation? That's very important because we gotta notify our staff, okay? The staff that's not on, the staff that's coming in, the staff that's going off. We need to notify everybody, right? So it's important that they're all in that system. So you need to know your people. There's still some people out there that may just not have cell phones like some people do, right? Some have different kind of phones, and then some of them just don't work with that process, right? So just know that about your staff. They may not get something. So you gotta make sure on what they all have. So know those people So you may have to go to the next step. You may have to call that person. If they're coming in to be scheduled to come in, you need to call them somehow, some way, okay? Have multiple options when you're notifying your people, okay? Especially when you're activating a COOP plan, all right? Make sure you do all those processes out there. You don't necessarily have to go on social media yet with your COOP activation. It's not really a public thing yet, but if you're notifying the public on something, then that's when you tap into your social media. Again, so you're going to create a process and a policy. Most of you have this already. Just make sure, just kind of review that process and policy of alerting and notifying people. And you have that already for notifying people, but just think of the COOP activation and then think of maybe the worst case scenario activation and how that would work. Is your process and policy going to work with that worst scenario? Okay, that's one thing to look at. It's time to review that policy and process. All right, alternate facilities to provide. All right, so what's your alternate facility? You got to move somewhere for temporary use. You got to make sure you have sufficient space and equipment, okay? Space for you, your people, patients, and your equipment all together. So, like when we're looking for shelter sites, right? Going, yeah, is there going to be enough room for the people? So, same thing with this, your alternate facilities. You got to make sure you can provide this. And a lot of times you can't just find one place. Unfortunately, sometimes it has to be split up and you have multiple sites. You got to do what you got to do, okay? So, but you want to do the capability to perform essential functions within 12 hours and 30 days. So, and up to 30 days. That's what your alternate site is supposed to do. Within 12 hours, try to get it operational, and up to 30 days operational there, okay? That's what we're going into that, saying we're going to be here for 30 days, all right? That's your plan. Just when we talk about sheltering people, we're not going to have it at a school during the school year because we're going to be there for so many days, they can't have school, so they're not going to like that, all right? So we got to watch that. Even churches, you have a church, they have Sunday comes around, there's Wednesday night services, all that stuff, impacts. So you got to watch how you do those things. So same thing with your facilities you're looking for. Make sure you can do it for 30 days. Reliable logistical support services and infrastructure systems. The good thing, logistical support, is your system, your organization has some decent logistics. You have your resource group, you have your people that are your vendors, things like that. It's not a problem. But it's making sure the infrastructure that you're going into is able to support you for everything you provide. Consideration for health and safety for personnel and your clients and patients, all right? But make sure safety, it's a safe place to be at. So don't just go, we're gonna go to that location, we're gonna pick that building, that's where we're gonna be as our alternate care site, that's where we're gonna do that, and never visit there. Don't do that. You actually have to visit the place, walk through it, make sure it works for you, okay? Because you walk in and you go, oh, this is not going to work. Oh, they don't have an elevator here. Oh, they don't have, different things that take place. Collaboration with emergency manager to help you do that process. Know your emergency manager, get to know them. Cities appoint an emergency manager also, but your county emergency manager is a good one to go with, but don't bypass the city one too, because the city one may know some things. Interoperable communications. How to communicate. This is everything across the board. So you're going to have a communications plan that you have in place, and you're going to be testing that plan. That plan has to be going not just your normal day-to-day operations, but now you have a COOP event, and you need to do some stuff. How do we communicate with staff, personnel? How to communicate with logistics? How to communicate with our resources out there, our supplies? How to communicate with infrastructure? What's that communication look like? And what happened that caused you to leave your building that could knock out some of the communications, right? So we got to do, all those steps have to be made in that process. One thing we like to do, actually, to look at alternate sites, bring your IT person with you. They need to look at the alternate site, because how can they set up quickly within the 12 hours? Can they set up the IT site in there? Okay, can they do it? Can they not? Bring your people with you, not just you by yourself. Make sure you have some staff coming with you to help with that process. We like to, like to bring maintenance people too, just to help out with that process. And if it works for them. Do we have a loading dock? Do we have, what's our process here? It's not just simply saying that building looks cool. You actually have to go through the process and walk through it. And when you meet with that facility, then they know that you want to use this agreement, and they'll tell you, well, yeah, we have an agreement with this place and this place. So they can maybe help alleviate those things. So again, computer and equipment software, we kind of talked about that a little bit, but make sure that IT is involved. They're going to have a system set up. So whether they have it online, being backed up in the cloud, something in the cloud maybe, or it may be just internal for that site that you may be operational for a few hours, a few days. You may not be able to go up in the cloud. You may be just kind of like intranet possibility, okay? Depending on the IT person and what they can do, capability they have with the situation if certain things are knocked out in your area. Badging and security access. So again, building looks great, sucks for security, okay? So that's why we go visit. Is this a good, secure place? All right. Again, safe for our personnel, safe for our clients coming in, everybody else. All right. So badging, make sure we have a badging system, because your badging system that you have at your facility now may not work there. Okay. Or maybe it does. Maybe you can do a process that works fine. So only your staff that's already badged can come there. Or it's only a certain group that gets to come there. Maybe it's only a few departments that are moved, and just they only have access. So you just create something. Maybe it's as simple as having a security guard to get hired on that's at the door, and they have a list of people who can come in, and that's whoever gets in. That's it. Okay? So simple processes with that. Look at having a desk when you walk in and say, we could have a desk here with a security person. But it's an important step, right? So we now rely on our locks, right? Evenings we try to lock our doors and stuff like that as much as we can. Have maybe one door that's open, the emergency room. Sometimes you have a buzzer for that too. So whatever you have, and long-term care, your doors are locked most of the time at night anyway, right? So even daytime, I don't know if you do that too. So it varies on the situation in the area you're in. So badging, security, access, so important. All right, so here's an alternate location facility worksheet that would actually go right in your COOP plan, okay? This is an example one, this is not the one, all right? So you can have the name of the alternate site, the point of contact person. So who's that facility, who's in charge of that facility, who's that contact person? May not be the person in charge, but just who's the contact person? Who's got the key, who's gonna let you in, right? Call them a key holder, all right? And with emergencies, dispatchers, they have key holders, okay? We like to have them 3 deep too. So not just one person, it's nice to get a couple people on that. Phone number, alternate number, main numbers you can get. Complete address of the site. That's important because we're going to tell our supplies where they need to go, right? Suppliers. Equipment that's on site. So we're going to do our walkthrough. We can see what they have already that maybe we don't need to worry about bringing in, that we talk to them about using, okay? So maybe they have certain equipment that you can use there. Instead of bringing everything over from your facility that you can, if there's possible ways you can leave some things behind. And honestly, even a copier. Sometimes a copier, simple copier, they'll say, yes, go ahead and use it. You guys are now leasing the copier from us, renting it out, okay? Because moving a copier, number one, if you guys lease and own copiers, and if you're paying a maintenance agreement, you move that copier, it's now yours. They're not going to cover anything. So you have to have the company actually move it for you. Otherwise, they're not going to do your maintenance agreement. If something breaks, you're being charged for it. So just FYI on that. Support staff, contact information, all that good stuff. The IT stuff, security stuff, anything specific you want to put in there. This kind of goes a nice little sheet you can use in your COOP plan. Slide it right into alternate location. You can have more than one, right? So you can have even, there's a line you can add on to what it's best used for. You can do that too. What is this site best used for? Which departments would be best for this? Which department could not be used here, okay? Because there's probably not a facility in your community that could take your hospital or your even any long-term care. There may not be a building in your community that can take that, right? Just, you can't take everybody. So you got to figure out what is the best suited for these locations. Goes back to the essential services. What do we need to provide? That's what we're going to find. Vital records, the fun part, yes. Records, documents, damaged or destroyed, disrupt agency operations and information flow, cause a considerable inconvenience and require replacement of recreation and considerable expense. It does, it's terrible. So luckily, most of us have nice into electronic system, hopefully, and hopefully it's backed up in the cloud, right? Make sure you can access that cloud then. So that's why IT is important. When you move, you can still access vital records. We'll talk about that a little bit. So, documents and records. So the emergency, the plans, job action sheets, line of succession, all these things are important documents, not just patient stuff like that, right? We got to make sure all of our stuff is accessible and ready to go. If your building gets destroyed, that's where your binder was of your plan. Hopefully you had an electronic version in the cloud, right? Or some of you may have taken it home. That's okay. Some of us put a copy, like some emergency managers actually have you have a copy maybe with you sometimes in your vehicle. It happens. Some do that, some don't. Some have electronically in their vehicle, separate from their office. So that you just got to make sure you have that other options where that stuff's at. Okay? Legal, financial, payroll, contracts, personnel files, all important for that stuff. So we got to make sure we are have at least within there. The biggest thing you can put in the COOP plan is saying, see our records, our record retention, things like that, policy for the system. You don't have to recreate something in your COOP plan, okay? Just that you have a policy somewhere and that you have access to it. If you had to initiate your COOP plan, go to an alternate site, how would you access that stuff, okay? Again, don't recreate the wheel, have something you already have in place. Again, software and applications, same process there, that you can access those things. If you have a bunch, facility got destroyed, a big portion of, you have laptops, computers are all destroyed, how can you get going again? Where is that Microsoft and email update, all that stuff, databases? IT can get the new computer in, hook up the system, get going again as quickly as you can. Again, same thing with computer, phones, internet. All about IT, this process too with vital resources, okay? Contingency staff. Personnel, department designated to report to the alternate facility. Because again, maybe you have a portion of your facility that's damaged, that's not operational, you have to go to alternate facility. So who are those people that go, all right? Also, they're gonna go ahead of time actually, and they're gonna implement to make sure they can go and perform this stuff. So you may be continuing some services at your facility, but you need to get out, you need to move away from there, but you can't just send everybody out of the hospital because you have patients. Long-term care, you just can't leave everybody there, right? So you have to have some people moving on to other areas gradually in an orderly fashion, so not everybody for themselves. So we got to make sure we're able to do these things and get it set up so it's ready to go. So who are those people? Who is that team? Well, that activation team I talked about, that's some of those people that can help activate, get to the alternate site, get things moving so it can be set up and ready to go. Devolution, here's the real one of the definitions. Capability to transfer statutory authority and responsibility for essential functions from an agency's primary operating staff and facilities to other employees and facilities to sustain that operational capability for an extended period. Okay, which can be in your facility too, but it's mostly other facilities. Okay, so they're transferring that authority to other employees and facilities, sustain operational capability. This one here, lawyers, leadership takes care of this. This is not your area. This is where you're gonna have to go to leadership, attorneys, making sure that you have to have something though in place. It's not really, I looked in this, I don't think the CMS rule has anything on devolution, if I remember right, but it should be in your COOP, that it's there's a process, but I don't know if it's CMS is required. All right, reconstitution, phase 3. Reconstitution is a process by which organizational personnel resume the normal operations and they're from the original or replacement facility. So they are now resuming operations. So they might be in a brand new facility. They might be in the original, back to the original place. Wherever they're at, you may have to build a new facility, that's fine. So wherever it is, you're now back to normal operations. That's reconstitution. So when that's in your COOP plan, how that process is laid out, what that process is to become back into resume normal operations. Show you a quick little decision process, a little matrix you can have in your COOP plan if you want. This is just one that was, it's just a very general one, okay? And this was work hours, non-work hours, which doesn't really reflect healthcare because you're always work hours, okay? What you could look at is like daytime and evening because you have different staffing levels, okay? So look at it that way, all right? So daytime, event with warning. Is the threat aimed at the facility or its surroundings? Is the threat aimed at agency personnel? Are employees unsafe remaining in the facility and or area? So we want to know those things, okay? So if we need to enact our plan or not, right? Because we can be prepared for something, right? If we have a tornado that is coming, the sirens are going, make sure we have somebody on staff that's watching that system, right? Sirens are going off, yep, we're being detected now, what's going on? Make sure somebody is actually looking at the radars and finding out what's going on. Is this tornado on the ground? Is it close by? Is it 10 miles away? Where's it at? Because I can actually start, if there's a tornado on the ground, already damaged a big portion, you know there's a lot of damage, you can actually already enact your COOP plan, get people aware, okay? Not calm, aware, because the threat's still there, right? Especially daytime, they're there, right? So we can say, hey, this is what's going on with your staff. You can communicate with them. Event without warning. Is the facility affected? Okay, so maybe there was an explosion nearby. Okay, was your facility affected or not? Are personnel affected from it? Have the personal safety evacuated? Have they safely evacuated, or are they sheltering in place? What are instructions for first responders? You have those? How soon must the organization be operational? These things you're going to ask yourself right away in the leadership group to find out if you're enacting your COOP plans, things like that. Evening hours, we can say. Threat aimed at the facility again. Look at these same processes. Who should be notified of the threat? That's a good thing, especially in the evening time. Might be a little different, so your night staff knows who to contact, right? Who's in charge? And again, is it safe for employees to return to work the next day? That's a good thing to put out too, right? So as we have our notification system, hey, no sense in coming to work tomorrow. That's an easy one because everybody goes, okay. So they like that one. But it's going to be, everybody's coming to work, but just not here, right? So we're going to tell them where they're going to be going. Again, without warning, is it affected? Instructions, and then how soon organization be operational. You may not know that right away though, okay? But you may have to enact your COOP plan. It's just something to throw up here just to get a process moving so you can have some thoughts going in your planning group. Just think about some things. There is different things to look at. Daytime, evening, weekends. There could be different response from your staff. And your services, right? Because not all your services are done 7 days a week, okay? Some services you just do during the week, during the day. COOP activation phases. Phase 1, emergency response, initial activation. All right, phase 2, we look at event assessment. We're going to assess our workstation or facilities, any impact we have, okay? Any impact that we have, outage length. So maybe it's electrical grid down, system down, in the community even. How long is that going to be? How long can we sustain on backup power? Okay, those types of things. Notification implementation, again, so notifying your people, communications protocols. So we kind of established that already, got to have that in place. Preparations to arrange transfer activities. If you're transferring people out of your facility, you're transferring personnel, transferring records, equipment, all that stuff has to be arranged, okay? Getting that moving along. Continuity of operations, okay? The execution of the essential operations at alternate facility. Public information. So we're going to partner the media, stuff like that. We're going to partner with those folks, getting that information out to the public. We have an alternate site that they need to go to. We need to let them know, okay? So we'll get our public information officers going, right? Which they will be anyway, big incident. They got to make sure they squash the rumors and everything else. You got to get good messaging, get ahead of that stuff. This is where you find that alternate site, when you're going to be open. You tell the public, we'll be open for, maybe we're opening urgent care at this address. At this time we open. That's where they go. Again, then the reconstitution, the final report activity, that's when you return to normal operations. After action report created. We do after action reports for our exercises, which are good. Try to find those improvements. You can find out what happened good, what was bad, improvement plan, all that stuff is all good stuff. But when you have a real world event, it's even better yet, because you can actually really, really look at your whole plan and system. We can only do so much in exercises, okay? When the real world hits, you can learn a lot, and you can change things, and the things that you thought were probably the best things ever in your plan actually end up being the worst, and some of the worst things in your plan actually being really good. And some decisions you made during the event were great decisions that you didn't think of before, and that's okay, all right? Again, so whatever the situation is, you have to adjust. It's a plan is there to be there, but it's not 100% follow it completely, okay? I want to make sure that's clear. It's okay to be fluid. All right, module 2. Application continuity principles in emergency planning. All right, so program initiation and management. That first group, okay? We're establish the need for a business continuity program. We know that, right? So we want to make sure we're doing that, or that's why we're here. Obtain support and funding for the business continuity program. So we're going to talk to our leadership, making sure that we get the funding to help do that process, get our team together. We have the funds to do that. Again, get that right away if you can. Build the organizational framework to support the business continuity program. So you're building that process with your planning team to make sure you can support it and keep supporting it throughout. When you let the leadership know that, hey, this first year or year and a half, whatever it may be, that's our expensive part because we're meeting more with people. You're paying the same people anyway, it doesn't really matter, it just takes them away from a certain position for a while. But it doesn't have to be all the time. But the money we're spending now on it is going to save us in the long run, because now annually we're going to keep going this and keep it a live document. It will save us in the long run. So building that support. So introduce the key concepts. Again, program management, not just a plan. Okay, risk awareness, identification of critical functions and processes. What are those critical things? Essential functions. Recovery strategies, how to recover from this. Our training and awareness, and our exercise and testing. So all those things are fit in that first initial area. And this will help you make sure you're hitting all your CMS rules, which we'll go through in a little bit. Risk evaluation and control. Identify risks that can adversely affect an entity's resource or image. Okay, so that's what we want to hit in this area. Assess risk to determine the potential impacts to the entity, enabling the entity to determine the most effective use of resources to reduce these potential impacts. So that's this area we're trying to do that. And then hopefully doing some of that with the HVA stuff too. All right, also identify and prioritize the entity's functions and processes. Okay? Again, we've talked about this already. Which one have the greatest impact? Or should they not be available? If they're not available, how do we get them available? If we don't need them, get rid of them. Assess the resources required to support the business impact analysis process, and of course, analyze your findings in the end. Because you want to look for your gaps when you analyze. Where's the gaps? That's why we do trainings and exercises too. We look for those gaps. Where's that gap in the system? Delegation authority, again, we kind of covered that a little bit already, so I'm not going to repeat those. Succession planning, make sure it's all in place. Alternate facilities, we talked about that. That's kind of where in that alternate strategies area, they like to put that in that area. Emergency response and operations, incident management system, have one. I don't know if you follow the ICS, HICS, and stuff like that. You guys have done training on, I'm sure. Incident response plan, hopefully you have response plan, emergency operations plan, those types of things, have those in place. And coordinating with outside agencies, okay? So your outside agencies, make sure they're aware of your plans, like you were talking about with emergency management, okay? Make sure they're aware. Emergency managers like to know those things. It's kind of nice to know that you have those plans. It's one less thing they have to worry about. But also, they don't need to, the emergency manager doesn't do anybody else's operations. they don't even do their operations. Okay, they have plans, but they're not operations. The emergency manager is not an operations person. Okay, they basically manage. They kind of help manage the resources. They help manage those things to help make sure that they're kind of a resource to go to get the resources. Okay, they're not operations. Okay, just FYI. Document plans to understand during an incident that will enable the entity to continue to function. Okay, so to make sure that we're able to function, especially in our essential functions. Training and awareness, I think we can get that pretty good. We understand that process. I'm not going to beat that to death too much. Public relations and crisis communication coordination with the community. Again, we want to make sure we're having public relations and communications, right? So we want to make sure our PIO, Public Information Officer, is informed. They've been practicing, hopefully testing. And remember the Public Information Officer, there's that, and there is a spokesperson. Yes. They're two different people. Sometimes they like to be the same person, but it's also nice to have two separate people. So we got to make sure we have that clear understanding, and working together can help that. So if your neighbor comes over to help you out in your situation, maybe your PIOs can help each other. So I think that's one way to look at it as a regional group. Maybe having a regional PIO team could be wonderful for you. And you can go to emergency management. You can go to emergency management, and your emergency manager can get state assets that will help out with PIO. Homeland Security, Department of Public Safety has a great PIO group, and they tap into the other state departments too. They can bring in the MnDOT PIOs, State Patrol PIOs, Homeland Security PIOs. I mean, all these PIOs can come in and help with the situation, okay? So, and there's regions that are developing teams, PIO teams, not just in healthcare, but also in other areas. So it's becoming more and more prevalent to have these teams available. Because you gotta work together. Crap hits the fan, there's so much to do. There's full-time just monitoring social media. Okay, so work together, collaborate with that. So in the communications plan, that's what would be helpful. If we can do that, and maybe it's something the coalition can look at, maybe that's one of the areas we can look at, maybe providing something like that, or helping arrange, along with emergency management, with a PIO team or something like that. So I think it could easily work. So, and others have started doing that already. Third and last module, required elements of a COOP, the CMS Emergency Preparedness Rule, Field Surveyor's Tool. So this is when they come in, CMS comes in, survey your facility, okay? Their tool they use. And what we've done today is pulled out of all those areas, the surveyor tool, the ones that really impact COOP, okay? Or things you have to have in your COOP plan, all right? Things that they'll be looking for, okay? If you go to cms.gov, you will be able to click on, Medicare. You go down to quality oversight, safety. Under the provider enrollment and certification, the quality, safety, and oversight group emergency preparedness. You click on that. Over here, emergency preparedness rule. You go down, and in here, you see surveyor tool. Okay, so I hit the button, and down here, its screen's cut off just a little bit. But that's where it comes into, right? And you have to load just like you download something else off the internet, right? So you click on that, and it comes up in Excel, okay? It's an Excel document. But over here is the number, and it starts with 1, and it goes down to, I don't remember, 44 or something, maybe more than that, 45, I can't remember what it is. But each of those are steps on the surveyor tool, okay? This here is the groups. If each one of these impacts that group. So there's clinics, there's all this other stuff in here, right? Whatever you are, that's where it hits. This is the mumbo jumbo jargon that attorneys use. Don't read that. It'll confuse the heck out of you. Okay? The interpretive guidelines, much better, okay? The bad thing is it's a really big document, but if you look at your Excel, if you go here to, first one, number C right here, I do my I'm gonna roll with my mouse. See where it says 3 down here? I roll with my mouse. 4 is there. Sometimes if you roll too quickly, you'll skip 4 and 5, and you're like, and you may miss something that you may have. So what I like to do, you can shrink it down. Okay, you can shrink this down, but I like to read it. So anyway, there's a little arrow. You can just hit that a little bit, and it'll just barely go down for you. Okay, just FYI. So what you can do with number 4, I care about this. I mean, we're gonna look here if it affects me, right? But here, you can double click it and it expands the whole thing. So you double click it, it expands it. Let's see, so it talks about this one, has all this stuff here. So facilities are required to develop and maintain an emergency preparedness plan. The plan must include all the required elements under the standard. Plan must be reviewed and updated at least annually. See, it tells you right there, right? So the annual review must be documented to include the date of the review and any updates made to the emergency plan based on the review. The format of the emergency preparedness plan that a facility uses is at its discretion. So that's why you can use any format you want. Okay, it's okay. Okay? If you want to use some weird one, that's fine, as long as it works for you. All right? So this is where it talks about some of the areas. The key area is right here, survey procedures. Okay? And I'm going to go to that. So we're going to kick out of this for a second, okay? So we're done to number 4. All right, number 4. And again, you can access this tool, have it all for you. I'm going to give you just the highlights for it. So updated annual documents is what you're going to be doing, the documentation of your annual review, those types of things. Your risk assessment, COOP plan, and hazards, you want to make sure you're looking at, right? Have part of those documents. Say, so COOP plan says it's in there. It says COOP plan in the surveyor tool. Care-related emergencies, you want to have included in there. Equipment and utility failures needs to be included in this section. Cyber attacks need to be included. Loss of facility needs to be included, okay? It's spelled out in those big paragraphs. It's in there. I'm taking some key stuff for you guys to make sure you're doing. Supply chain. How's the supply chain? How's it being affected? Roads, ice storm. The biggest important piece is, again, that survey procedures. That's what they're going to ask you, okay? A lot of times it's asking leadership, okay? But they're going to ask they're going to look at your plan and verify you have the plan. That's there. Now, I'm not saying they do this. They're supposed to, okay? Let's put it that way. They can ask. They'll ask leadership to identify their hazards. So hopefully your leadership's informed of everything, right? It's important, okay? Ask leadership to identify the hazards. Review the plan for required elements. So they're going to review your plans that they're meeting the required elements. They're going to look through your COOP plan and make sure it's hitting the required elements. Just out of this number 4, right? Basically covers the rest of it almost. Verify, reviewed, and updated annually. They're making sure that your plans are updated annually and reviewed. It's documented that's being done like that, okay? I don't care how you do them, but document it. You should look at them. You should make updates. You should change them things, but make sure it's being documented. Okay, number 7 is the next one, kind of COOP related. Plans specify the population you serve within the facility. So what populations, what groups are you serving? Do you have special services that you provide, right? So what are those groups? You have to identify those. Policy, patients requiring assistance during evacuation. So you have to have a policy in place if you have people who need mobility needs during evacuation. How do you do that? What's the process? What's the policy on that? Okay? Has to be included in there. Types of service and who is doing it during emergency. So what type of service do you have? Who's doing it? So if you have evacuation, who's doing the evacuation? Who's providing the mobility issues for this group? Who's doing that? Identify it. FEMA and ASPR are very good resources to go to. I'm trying to remember the name of that. What's it stands for? As resources to use to help you with this stuff here, okay? And we can show you some stuff from FEMA and ASPR also that will be included with electronic documents, okay? Because a lot of stuff follows along with any COOP plan, right? It's not just healthcare or anything else. A lot of stuff follows along with any COOP plan. And FEMA does have a good process with that. Survey procedures. So again, they're going to interview leadership. Okay, this is why leadership needs to have a support of your COOP planning, because they need to know what the heck they're supposed to say when they come in and talk to them, or they're going to grab you to come in with them. So interview leadership. Patient population, what's the risk? What's the risk group? What do you have in your area? What's your population? Strategies for a risk group. What's your strategies to take care of that group? Have identified. Services provided for those groups. Plan to continue operations. What's your plan to continue it? Those are the types of things under 7 they're going to make sure they're going to hit in their survey tool. Okay? Delegation authority and succession plans. That's where that comes in. So they're going to look at that. Again, we've got it in our COOP, no problem. We're good. We're golden. Establishment of the EP program, OPO, organ, right? Or organ stuff. Organ agreements, that what roles staff have. Survey procedures are. The services for organ, if you have a location where you send people for transplants, things like that, or if you have transplant services. OPO plans to continue operations, how you do that, who you're working with. So if you have people, if you have this process in your facility and you send people somewhere for transplants and that place is affected, where do your people go? You have to have what the process where you turn them to. Delegation authority and succession plan on that too. Again, it may not relate to you, but we're just pointing out the ones that are COOP related. OPO agreements with all the hospitals that they do work with on those processes. Policy and procedures for medical documentations, MedDocs. Patient records are secure and readily available to support continuity of care. So they're available. So that's why we have to have an alternate care site. Also, we have to make sure that we have that process in there so that they're available. So when we move to an alternate care site, we can access those records right away. Again, IT is important, right? Cloud system, everything else. Have internet accessibility. And sometimes internet can go down. And cell phones go down, you know. Systems are better now than they ever have been. It takes a lot to knock stuff down, but it does happen, okay? So if your system's knocked out, how do you access those records? So you have to look at all those things in your COOP plan, what's those risks, and how do you achieve those capabilities? They're gonna wanna see that. And that's what they're gonna do, they're asked to see the copy of how they're secure, readily available for you to continue care. But they have to be secure, like we know that already. Number 25, arrangement with other facilities. Prearranged transfer agreements. Have those MOUs in place. So survey is going to ask to see copies of agreements. If you do have agreements, they're going to ask to see those agreements. They can look them over. They're going to ask leadership to explain transportation during evacuation. Okay, so those agreements can be for evacuation too, not just, we're not just talking about ambulances, things like that, we're talking about buses, things like that too. Okay, so explain. Leadership's going to have to explain how they do it. Educate your leadership, right? Number 26, roles under a waiver declared by the secretary. This is the waiver form to waive certain rules, okay? We'll talk about that here in a second. Policy and procedures that describe role in providing care at alternate care sites. Okay, so if you are, by rule, you just can't go practice anywhere you want, right? So we got to make sure we're clear. So we have to make sure we have policy and procedures in place to do those things at alternate care sites. We'll get here in a second. Role during declared emergencies, what those roles are, so you can clear what needs to be happening under waiver. Coordination efforts, waiver requirements granted. So if you have requirements, waiver requirements granted to you, you have to have how you're coordinating that, which you could have different nurses, doctors, those people practicing maybe in your facility that aren't from your facility. There's waivers that can be used for this process. That's just one of the things. So they're going to verify the policy and procedures. Section 1135 waiver, and a lot of those policies, when it comes to this stuff, it's your attorneys and stuff looking at it anyways. It's not you writing it. It's somebody else. It talks really about, national declared or, state declared, local declared disasters, public health emergencies are in 1135 waiver. Includes a licensure for physicians and others to provide services that affected state, the EMTAL, all that good stuff. So it talks about those things. So yeah, you may not need it, just has to be there. just as we talked about. All right, names and contact information, pretty simple here, but contact list with other like facilities. So if you have services you provide that you may be different than some other ones, who else can provide that for you, or you got to send people to. That's one way to do it. Contact list with other like facilities so that you can help move patients to that, memory care. If you're a memory care unit, hospice units, where do you send them to? You just don't send them wherever you want to. You send them to certain places. So make sure you have those. Again, the motherships have those already in place, but some of the smaller agencies don't have another facility, so you have to find those other like facilities to send them to, right? So you do your long-term care, yeah. Yep, so you have to find those other places that take what you specify in, right? And it could be your neighbor, it could be way down the road, okay? Which gets really difficult with evacuation. Evacuation can be very difficult, especially in the specialized areas, because it needs certain transportation, and it needs a lot of really working with that other facility. Meanwhile, you may have another group of people, so it takes more than one person trying to arrange all this stuff. So it takes a little bit of work evacuating. It's not a simple thing, okay? So hopefully you test your evacuation. It's hard to do a full-scale evacuation. It'd be wonderful to do that, but it's hard on the patients, so we don't do that. But I think it's time we do some simulated patients and have an area where we do a full-scale exercise. We can, maybe it's getting a building that's no longer being in use and put patients in there, play patients, and just kind of let's do an evacuation, see how the process works. Communications with transplant centers, if you have that, if you have to go to transplant centers you have to communicate with, got to have that down. Verify all required contacts on the communication plan. So your communication plan, again, has to have all these facilities' contact information on there so you can contact them, okay? You have to verify that is there. Again, verify reviewed, update annually. Communications plan, contacts, make sure they're reviewed and updated. Very, very important, right? You change things, someone adds new specialty, your neighbor adds it before you're way down the road with somebody else, add them in there, needs to be updated. Methods for sharing information. Communications plan, again, for information communicated to facilities during evacuation. So this process has to take how you're sharing that information with them again. It's part of the communications plan, but also the release of the information permitted under 45 CFR 144.510. Talk about that a little bit. Policy on HIPAA during disaster events. But with the verify the communication plan methods to share the information, they're also going to verify a policy and procedure for release of information during a disaster for general condition and location. So you can, remember, you can say, we have, there's a school shooting, right, or a business shooting. So we have, 11 patients were brought to our facility. We have, 4 critical. To release that information, you have to have actually a policy and procedure on that, how you do that, and the location that they're at. So you can say we're not going to release anything. That's fine. I don't care. That's not my job to tell you that. So, but you have to have a policy in place and procedure. If you don't, people go rogue and they start saying the wrong things. That's where PIOs are important, public information officers, right? See how everything just ties together? But we've got to make sure we have it all covered, okay? You can't just say, well, we all know that. No, you have to have it written down, okay? Because when they come in and look at your information, they need to look and see it in writing what your process is. It's all about process. Process. And practice this stuff, okay? Get a camera in there someday and just have actually have your PIOs, your spokespeople, practice right in front of a camera. And just give them some stuff to talk about and say, here, this is the release we're going to do, and have them talk. Great, best practice you can do. It's wonderful. If you have TV stations, they're happy to play with that. Emergency prep testing requirements. Conduct annual exercises of the plans, okay? Full scale, not FEMA and exercise planning program, the HC program version. It's not that, okay? It says full scale. When you read that mumbo jumbo, the first section, that middle section, I told you that mumbo jumbo part that don't read, it says full scale exercise. It's not FEMA HC version. it means you can do workshop, tabletop, functional, whatever fits your need. It does not have to be full-scale exercise. Again, so if you read into it, and it's in the tool, and we can share a little more on that, but it's not, it actually specifically says not the FEMA HC process. So, exercise with others, again, so we want to be able to exercise with others. That's a good thing. I mean others, everybody, emergency management, law enforcement, all the departments out there. Exercise with other people. Get together. Healthcare coalitions, you're doing that now, right? You're working together, but also work healthcare coalition with the emergency management group, okay? Regional emergency management teams, groups are out there. So the full scales are great. They're wonderful, they really are, but doing that functional is so important because you can bring a bunch of people together and work on this process and be keyed in on a couple little things instead of having a big full scale moving equipment and everything else. So documentation of playing with others. So we got to make sure we're documenting that we're playing with others, right? Yes. They like to see that. They want to see that. It's going to be included, all right? That we are playing with others, we're not just on our own. Engage with the healthcare coalitions out there. Also, you can look at the emergency management, again, regions are great to partner with. I think we should actually do more trainings together, to be honest with you, because there's a lot of overlap that we can help each other out in. So invite each other to trainings is great. And doing that ahead of time, so planning out for the future is a good way to do that process so that you know when there's a functional exercise, whichever it's a healthcare coalition or if it's emergency management, come, play, be involved. We can throw you in the plan, X plan. We can help cover we can touch a exercise for you for that year, okay? So there's different ways to look at that. Documentation and compliance of exercises again. So with that is, we want to make sure we have, I think I might have it here, what they're going to ask for. I think I do. So here it is, yes. They're going to ask for documentation of tabletop or full scale, tabletop to full scale, okay, all the way through functionals. They're going to ask for your exercise plan. The after action report is an important piece. There's no set, there was an HCEP compliance thing that was out there for a long time. It doesn't have to be perfect to that whole, how the process flows. It just has to be a document of after action. And what happened during the exercise, what was good, what was bad, and any improvements needed, any changes you may have made to plans are all good things to document. They're going to like seeing that. It's all important pieces. Ask for documenting, again, analysis and any updated info. So any analysis you did for those efforts and then any updated info you did to any plans. Just make sure it's all documented, okay? Don't just change a document and don't go like, oh yeah, we got to change this. Have a documentation that follows it. They like it, they'll eat it up, and they'll say, God, you guys are doing good. You put the surveyor in a good mood, it's always good. It's a win-win, right? If you have your ducks in a row and you're doing a really good job and have a lot of documentation out there, they're going to treat it much easier and much flow. So, and you make their jobs easier. Have this information available. That's the other thing with this. You have all this, know where it's at. All right, we're getting close to the end, okay? The big important, standby power, okay? So NFPA, National Fire Protection Agency, there's number 99110 in there. Talks about essential electric systems, okay? It talks about, so it has to be like in updated facilities, has to have the right system in there. It also talks about the location of the generators. So this here is remember that section where we said to one to look at? And I double clicked it. Right here, this is small print, this and this are all in that. Yeah, it's a long one, okay? So you might just want to print that one out. It talks about generator locations and where they need to be. There's like new, if you're building new, if you have an old facility, things like that, talks about what you can do. It also talks about inspection and testing of the generators, which I'm sure you do. Most of you that have generators, hopefully you have them. But the system is to make sure that you have a good essential electrical system that sustains damages and different flows of different risk things, so that you have something that's not always, okay, power's going on all the time. Now we're without power, and then it comes back on again with backup power. It's trying to maintain your electrical system in your facility. So the survey, I'll get to it, I'll read it through here when we're done here. So verify standby power, review shelter in place for standby power. Because if you're sheltering in place, do you have enough power to keep that going? Or do you have to get rid of them? Construction relocation, there's a process with that. So if you're having construction and you need to relocate your generator, there's a process you have to follow and where that needs to be. Fuel source maintained for standby power. So part of that, let's see if it says anything about that. Fuel sources for generators to be liquid petroleum products, gas, diesel, natural or synthetic gases. So again, read through those things. A lot of reading. Some of it's mumbo jumbo, but it refers to certain things too. It'll refer to certain requirements in sections of the NFPA. It'll talk about all those things. We'll try to get those links for you. And again, maintain your fuel source for standby power. Again, this is for the organ things, but if you need it, we'll just go through it real fast. Verify protocols, every certified transplant program associated with it. And plan for operations at alternate locations. Okay, so I'm going to show you a couple things. This is by the Assistant Secretary for Preparedness, and Response. Yes. The template that's out there that they have, this again, just showing you some examples of things, okay? It's not, it necessarily has to be all encompassing here, okay? So it just gives you your table of contents, some things that they have. They throw in some guidance circulars, which are, FEMA has those available. And we can show you those too down the road if you need to. They're really good to show some guidance on the COOP planning process. Some of the things I even showed you today really come out of that guidance too, actually. So just the table of contents, and then it goes into your, what it could look like, the purpose of your continuity operations, your risk assessment stuff, orders of succession, has who should be there, successor 1, 2, 3. Delegation of authority, has that in there. Continuity facility, identified types of facilities are out there. Continuity communications. Again, it doesn't have to be this way, all right? This is just an example of something. Devolution control. Just kind of go through it real quickly. We'll send out a copy of this with the system. So just kind of gives you the idea of what things look like. Again, your COOP plan can be anywhere from 8 pages to 25 to 50. Depends on your facility. Again, to show you a little bit more, here's their interop capabilities, alternate care sites. They had a bunch of them. Doesn't mean you have to. So they had, looks like they had three hospital. Critical infrastructure, supply matrix. They had a bunch of supplies that you can include in there. Things you need, MOUs, and just a bunch of definitions. Again, just examples. I'm going to show you emergency management one that's more of, well, yeah, more towards business continuity operations, not necessarily healthcare one. I just want to show you another. Again, it's not about the content, it's about the template. University of Minnesota did a nice job with this one, to be honest with you. It's a departmental one. So, again, they have their table of contents. Introduction, they talk about the purpose, the scope, assumptions, and this one explains what you should do, their department. So it says, department introduction. In this section, you should describe your department in general overview, what your department does. Included should be who you serve, what facilities you occupy, and your overall development goals. It's a nice thing to have to your department people to say, hey, I need you to do this for your department. Okay, it's a good way to pull things out of them. Identify what the purpose of COOP is for your department specifically. Okay, just one of the things it has. They have the level 4, 3, 2. They have some different stuff that they use for their levels. Again, it's just an example again of a template. They have a little thing where they can see who does what. Essential functions has priority 1, 2, and 3. So it has a little matrix over here. What's a priority? So it's a priority 1. Here's the function. Here's who's doing it. Here's the supplies they need. Here's the records they need. Those types of things. Again, personnel or succession. Designation authority. Devolution. Worksheet. Alternate locations talks about interop communications. Training. Just a simple one. It has some annexes of some paperwork you can do. Public health emergencies talks about that. Just a couple examples of that real quick.